Hello, this is Annie. She's my Border Terrier. This is about how to do a home exam on your dog, and it's real important for you to know that it's not designed to be a substitute for a vet exam at all. I'm hoping that I can just help you determine what's normal, and then that way you'll be able to tell if something's not normal, and then you'll be able to recognize things that might mean that you have to take your dog to the vet. Home diagnosis and treatment is not something I'm recommending. So Annie is being a little vocal here. Things to look for. Okay, first of all, you probably just want to keep an eye on the general appetite and attitude, and I'm sure most of you do that anyway, but if your dog is not eating, or of course if they're vomiting or have diarrhea, or if they just aren't acting themselves, you know, maybe Annie would just not want to do her normal things, doesn't want to play with her toys, doesn't want to go out for a walk. Those would all be things that would signal me to be watching her a little more carefully, and certainly if that's something that's going on for more than a day or two, then I would definitely want to get her into a veterinarian. But there's some things you can do looking from the nose to the tail on a pet that might help give you some ideas of how they're doing. So starting with the head, I know there's a lot of talk out there about noses and whether or not a dry and hot nose means that a pet has a fever. Not necessarily, however it can be. So a normal dog nose should be kind of moist and just feel the same temperature as the rest of the body. It's unlikely, though, that you're going to see, you know, a definitely hot nose when an animal's febrile or has a fever. But it could be, though, that you'll see it a little more dry. It is not something that you can count on, so don't make that an automatic. Eyes, you want them to be bright and alert, not have any swellings or discharges. Certainly, if you saw that she was squinting, then that would be abnormal, so be aware of that. On the ears, I'm really lucky that Annie does not have ear infections, but some dogs do. And part of the reason that they have infections is because the ear canal in dogs is really deep. Basically, you have this outer part, it's called the pinna, or the flap of the ear, and their ear canal goes way down and then down again. So they actually have a horizontal canal down in there that makes it even deeper than our human ears. So that's something to be aware of, that they can get infections and water and moisture down in those ears that can cause discomfort. So you might see them shaking their head or scratching at the ear. They can get things inside the ear, like foreign bodies and stuff. So it's important to know if that kind of thing happens. The mouth, of course, the mouth is really important. We'll have a whole nother thing on dental disease, but Annie's mouth is really pretty good. For a 10-year-old dog, she's never had to have a dentistry, but you might notice, if you can see closely enough, that her teeth are all flat. And that's because Annie likes to pick up rocks out of the river. So we had to nix on that. I had to buy her a rubber rock so that she can't do that anymore. But if you can see, her gums are nice and pink. That's normal. If you were to lift the gums of your dog and they were white, that would be really abnormal. Some dogs have black pigment, like a Chow Chow, and in those cases you can't really tell much with those guys. The neck, obviously there's not a lot going on here, but you always want to make sure that your collar on your dog is the correct tightness. You should be able to get about 2 fingers in sideways in the collar. You don't want it to be too tight, because I have seen pets come into the clinic where the collar is too tight and it's actually cutting into the neck, so that you definitely don't want that happening. On the general body, you want to make sure, we talked about obesity in another one, that they're not too fat, not too thin. Certainly the hair coat and grooming is important. Some dogs that have really long coats can actually get tangled and get mats against their skin. Same thing happens with cats. So that's something that you want to be careful of. You don't want them to basically have irritation to the skin because of the hair coat. Also, you always want to look for lumps or bumps. Like Annie's got a little tiny lump up here, and I've seen other dogs that will have little tiny lumps. But certainly if you're seeing something like that, you should have the vet check it out when you go in for the annual exam. Or if it's something that's ulcerated, you know, red, inflamed, or getting bigger, then you want to go ahead and get in sooner than the regular exam time. On the legs and feet, certainly toenails are a big deal, and either you or a groomer or your veterinarian can trim those toenails. It can be very unhealthy for them to grow too long. Some of the dogs that have what we call dew claws up here, those dew claws can grow right into the skin and cause a lot of irritation and discomfort. But the biggest thing with feet and legs is just looking to see if your pet is walking normally. Certainly if you see any sign of lameness, then that you want to see if that's continuing, and if so, you should see the vet for that. Again, those toenails are something that's probably a more common thing. Sometimes if they get too long, dogs will tear the toenails too, and that can be really painful. So when we get to the rear end, come down here, and of course, the tail. You want to make sure that everything's good here as far as grooming goes, because sometimes animals can get stuff stuck back there under their tail, and that can be pretty uncomfortable. It can cause irritation, and it can even draw flies and stuff in the summer, so you got to be careful about that. Of course, in female dogs, you have what's called the vulva, and you want to make sure that it's clean around the vulvar area. And in male dogs, you have the prepuce, and you want to make sure that that's clean so that it doesn't have a lot of soiling with urine or feces in either area. You've also probably heard about anal glands. Those are something that sometimes have to be expressed. So if you notice that your dog is scooting on the carpet, trying to scratch on the sidewalk, that type of thing, or licking, it could mean that those anal glands are too full. And that's something that a veterinarian can help you with. Sometimes groomers will do that. But there's actually some really stinky fluid that lives in there, and sometimes pets can get infected anal glands, so it is important to have those checked if you're seeing a problem.